Hello, my name is Cheryl Sarpong, and I'll be presenting my speech in front of my brother who's recording and my mom. Assisted suicide has been a controversial topic of discussion for many reasons. Many individuals find their controversies due to religion. People who follow mostly Jewish, Muslim, and Christian faith strictly discourage the practice due to their strict beliefs. Many of them stress that life is God's gift to give and should also be God's choice to take. Also, laws that allow assisted suicide basically give society the approval to kill, which means, by definition, those who are administering these drugs would be murderers. We would be saying that the lives of people who suffer from terminal illnesses are not important enough. Legalizing assisted suicide would also increase the pressures dying people may have to end their own lives, forcing them to take the easy way out rather than fighting the illness that they have. This would simply be immoral. Assisted suicide would also inevitably corrupt the purpose of medicinal healing, which would mean medical techniques and practices are used to kill instead of to heal, which means they are not serving the purpose they are intended for. This would ultimately defeat the purpose of medicine. Assisted suicide would even encourage the misuse of medicine. For example, barbiturates, which are used in euthanasia, are also used in brain surgeries and also in psych patients. Wouldn't this mean that we are abusing medicines or drugs that can be used to help people in exchange for killing them? By doing this, we would threaten the doctor-patient relationships. Doctors should solely be interested in the life and the health of patients, not in the death of them. Assisted suicide is also undignifying. Every human should see their life as having an immeasurable worth. The law must respect and dignify all terminally ill patients. By legalizing assisted suicide, we would be classifying a group of people as legally eligible to be killed, which contradicts the nation's commitment of equality in the eye of the law. This would mean we are basically telling people their lives are not worth living, and who's to say we are any different than Adolf Hitler himself? But you may ask, what about those who will inevitably face death? Well, hospice care should be a more prominent option, not death. Doctors should be helping their patients die with dignity and by natural causes. When I say this, I mean we should look to death by natural causes as not such a bad thing. That is where the acceptance of suicide begins. Doctors should instead seek to alleviate the suffering and withdraw from interventions that may bring death to patients. Many people believe it is easy for a healthy person to decide for those who are in pain, and those who are suffering should decide for themselves. I beg to differ. We must look at assisted suicide in a more selfless than a selfish way. Many see euthanasia as a means of relieving individuals of suffering and a painful death, maybe even allowing an individual who is suffering from an incurable disease or condition to die without enduring extreme medical measures. People even see assisted suicide as a way of even reducing the financial effects of hospital care and hospice on their family. All of the following reasons are true, but should not be a reason for death. Studies have shown that those who seek this type of death, assisted suicide, may struggle with anxiety and depression. For example, a 2008 study of prevalence of depression and anxiety in patients requesting physician's aid in dying shows that the current practice of Death with Dignity Act may fail to protect some patients whose choices are influenced by depression from receiving a prescription for a lethal drug. Which means that legalizing assisted suicide should not be a way we respond to our citizens. Why should death be the only thing we have to offer? Why not appropriate medical care, appropriate human presence, pain management, or even plaintive medicines to help their pain in a more humane way.